Okay, thank you, Rob. So it is 9:38. We'll call this meeting to order. Just want to remind the elected officials of their obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arrive, you may declare at that time. We have, can I have a mover, please, for report LTCR CM 1720, the 10-year capital forecast 2021-2030. Moved by Barb, seconded by Christine.
Thank you.
Thanks. Jennifer, are you taking us through this?
So thank you, Councillor Mackey. Actually, Joanna is going to take us through this report. But before we do that, I would just like to introduce to the group that Renata Cowan has formally moved into her role as of June 1st as the Accreditation and Quality Specialist. So we're thrilled to announce that that transition has happened. And introduce Stacey Goldie as the Interim Executive Director for Lee Manor. And so Stacey and Renata are there to participate in the meeting. Because the reports are based on information leading up to June 1st, Renata will contribute the information as the Executive Director, and Stacey is observing and learning. And so I'd just like to introduce Stacey to the group and welcome her to the team. And then I'll hand it over to Joanna.
Welcome, Stacey, on behalf of the Committee of Management. Welcome, and Renata, congratulations on your new position. Look forward to working with you both.
Thank you.
So I'll get started. This report is our 10-year capital report for the long-term care homes. It presents anticipated capital expenditures for the long-term care department over a 10-year planning horizon. This is by no means a budget. It is simply a planning tool that helps forecast county's capital requirements over the next 10 years and helps guide annual budget decision making. It's also a helpful planning resource for staff to make sure that we are looking long-term so that we don't have any surprises. It also helps us look at our cash flows and ensure the adequacy of our reserves so that we are prepared for what is coming. So we have attachments to the report. There's a capital summary for each of the homes, as well as one for redevelopment. Each project that's listed in the capital summary begins with a project sheet in our internal IT developed module. And the project sheet has the name of the project, the function, the estimated useful life, the location of where the project is to occur, the need or benefit of the project to remind staff why it is in the program, and we also show the funding sources for the project. We perform building condition assessments on our buildings every 5 years, and these are useful when predicting the timing of projects for when they are to be completed, as well as the estimated cost of the projects. Assumptions are used on inflationary adjustments, the building cost assessments, and the timing of when projects must be completed. It's staff's best guess until we get a little bit closer and we have more information. Each home summary rolls up to a long-term care summary, which is the first attachment in your report. This shows the funding needs for 2021 to be $2,184,000, which is about $16,200 higher than what was approved in the 2020 budget. This is about this is a 0.75% increase from the 2020 approved capital budget. As stated in the motion, staff will use what is in the 2021 year of the capital summary as a starting point for the proposed 2021 budget for consideration, and it will get tweaked as we get closer. Council will have the opportunity to approve or not approve these projects during the budgeting process. There are items in each home's budget that are common to all three homes. Certain items like beds, mattresses, resident lifts, and information technology are in a replacement cycle. We've included a list of notable items that are planned in the first 3 years of the capital forecast for each home. In this list, we've included capital projects that are new to the capital program, where the timing of the projects has been changed from the 2020 to 2029 plan, which is last year's plan, or where budgeted amounts have changed significantly. So now I can pass it on to the executive directors to begin to talk about the notable changes for their home.
Okay, thank you.
Sorry.
Who wants to go first, Shannon?
Yes, I'm up. Yes. Thank you, Joanna. So I have some notable changes to the capital projects over the next 3 years. The first two projects, laundry equipment and retaining wall, have been moved to 2021 due to COVID restrictions, and we are unable to have the work completed. Surface drainage and eaves troughs were booked for 2023, but moved to 2021 due to the potential flooding in the tenant spaces. Doors were originally booked in 2026, but moved to 2021, reason being the front door frame has been compromised. Parking lot, curbs, and guards that was booked for 2021 has been moved to 2024 to coincide with the possible redevelopment and the Markdale Hospital build. The next two projects, window sills and plumbing fixtures, are new projects being added because they are at the end of the service and need replaced. The last two projects have been deleted as work is completed through the operating budget. That highlights the notable changes for Grey Gables capital projects. I would be happy to answer any questions.
Thank you, Shannon. Are there any questions from members of the committee?
Mr. Chair, it's Ward McQueen here.
Go ahead, Ward, you have the floor.
Thank you. And it just more or less as Grey Highlands, municipality Grey Highlands is a tenant in the lower part of that building. I know a couple times we had some flooding issues. I presume that this where'd you listed here, the surface drainage and eaves troughing is or maybe a retaining wall. Is that something to do with trying to alleviate some of that issues around flooding? I think one time a hose got left on and then there was a rain event, I think, a couple times and it flooded the lower part. So just more of a general questions, but things that have happened.
Yeah. So that is the eaves trough, and the drainage surface is what's causing that. So that's why it's been moved up.
Okay. Well, we're happy to see that's happening. Thank you.
Well, there probably should be a rent increase then, Shannon.
Yeah, really.
Well, you know what? Long as it fixes the problem, maybe that would be a consideration.
Are there any other questions from members of the committee? I can't see Councillor O'Leary, so you'll have to just speak up, Brian, if you have a question, okay?
I don't have a problem with that.
All right, thank you. Okay, we'll move on to Stacy, I guess, at Lee Manor.
Thank you. I'll take it for Stacy today and
Okay, Renata.
learn as we go. So for our 2021 budget, we removed the caulking and sealant that was added to the budget from the BCA. We do that work annually through operating and feel that we can continue to do that. The redevelopment of the resident common areas because of COVID has been pushed to 2021. We've added a couple of additional blanket warmers. We purchased 3 blanket warmers this year or last year, sorry, and find that they are really beneficial for the residents for comfort, for responsive behaviors during palliation, and would like to purchase 2 more therefore one blanket warmer will be in each home area. We also took a look at our dining room chairs and our lounge furniture, and they are getting dated and worn and look quite old. So the areas need to be refreshed, along with the draperies. The draperies are original to the new build of 2004 and have been washed on a regular basis and need a bit of a refresh as well. So those are the additional projects to the 2021 budget and 22 budget. Are there any questions?
Thank you, Renata. Any questions from the members? Okay, thank you very much for the report. We'll move on to Karen at Rockwood.
Good morning, everybody.
Morning.
Changes for us for 2021. As the other homes have noted, we've removed the caulking and sealant to complete that under operation. And last year we were fortunate that we could purchase 2 blanket warmers with our donation money. We were originally asking for 4, so because we got 2 already, we're now only asking for 2, so have reduced that amount in 2021. That's it for me.
Short and sweet. Thank you.
Yeah.
Any questions for the Rockwood Capital?
Just a quick question, Mr. Warden, or Mr. Chair.
Go ahead, Mr. Warden.
Getting things mixed up here. Because I was thinking about so much what I was going to ask. Can you explain a blanket warmer? Like, so is it a blanket that you plug in that warms people up, or is it something that warms blankets up? It may be a dumb question, but pardon me?
Sorry, Mr. Chair, if I might.
Go ahead, Karen.
It kind of looks like a microwave, so it's like a case that we stack blankets in, and it warms them up, and then we can out as needed. And as Renata said, we find them very beneficial. We use them all the time, summer or winter, it doesn't matter.
Oh, great. Well, now I know. Now I know the rest of the story. Thank you.
Thank you. And Karen, they'll be transferable over to the new building?
Yes, they would be.
Okay. Thank you. All right, seeing no other questions, all in favor of those reports? That is carried. Thank you. We now have the report LTCR CM 1820, which is the long-term care financial update and projection as of April 30th. Joanna, are you taking this again?
Yes, I am. Thank you, Mr. Chair.
Okay, can I have a mover to get this on the floor, please? Moved by Barb.
I'll second
by
it,
John.
O'Leary.
Okay, seconded by Brian. Thank you, Councilor O'Leary. Joanna, go ahead, please.
Thank you. This report provides the first corporate update for the 2020 year for long-term care. It offers a financial projection to year-end for the long-term care homes based on revenues and expenditures to April 30th, 2020. It also summarizes the known and potential future financial impacts to the COVID-19 pandemic. Year-end financial estimates are difficult to predict given the uncertainty of provincial funding regarding COVID and the extraordinary expenditures and duration of time the pandemic will last. These year-end financial estimates are dependent on 4 factors. The first is the provision of additional COVID funding from the ministry. The second is the impact of the release of Case Mix Index, or CMI funding. CMI funding sets the acuity-based funding, and it's typically released in the first quarter of the year. It has not yet been released this year. Funding announcements for 2020 to 2021 fiscal year have also not been released. They've typically been released by this point, but they have not. And the fourth factor is the duration of COVID and its operational and financial impacts. So I've made certain assumptions in this forecast model. They include the following. Homes will remain free of outbreak. The ministry directives and regulations put into place over the last few months will require staffing levels and operational costs to continue through to December. The ministry will provide emergency funding support through to June 2020 with no further funding issued or assumed beyond June. And the fourth assumption is that the pandemic wage increase, that $4 per hour that we've all been hearing about, announced by the province, will be fully funded by subsidies from the province and will impose no additional cost to the county. We are projecting a proposed deficit ranging from a best case scenario of about 400,000 to a worst case scenario of just under 1.4 million. With the best case scenario derived from the expectation that the ministry will provide additional funding to cover the incremental costs associated with COVID. A summary of these scenarios can be found in the table, in the 2 tables that are under financial and resource implications at the end of the report. The first table summarizes our COVID-related incremental salaries and benefits, supplies and materials and supplies, and contracted services for each home. From these costs, I have subtracted the COVID funding that we've received to date from January to May, as well as the additional license funding for our 5 beds effective March 25th, 2020. The ministry has granted us 5 additional beds between the 3 homes. This gets us to the worst case scenario, which assumes no further COVID funding from the ministry. The second table begins with that worst case scenario and adds in what might be to lead us to a more hopeful best case scenario. The biggest impact that we could potentially have is receipt of additional emergency COVID funding from the ministry. And, if there are any questions.
Okay, thank you, Joanna. Any questions from the members of the committee? Joanna, the pandemic pay, is there some question that it may not be fully funded by the province?
I don't know that there's a lot of information released about it. I do know that they are providing the $4 an hour. I think what the question might be is whether or not the employer benefits will be covered, because they'll represent about 11% additional cost to that $4 per hour.
Okay, thank you.
Mr. Chair?
Yes, Mr. Warden, go ahead.
I was on a webinar the other day.
Sorry, Paul, you better start over again, please.
The other day I was on a webinar with AMO, and there may be a recording that staff may be able to go back, and it talked about the pandemic pay, and it talked about frontline workers, and and I don't know, maybe Jennifer is more versed with that or not, I don't know, but it was certainly not a management side. It was only for the frontline workers, and it did talk a little bit about not to be matched funds it said that it wouldn't be pensioned allocated, so the $4 premium wouldn't go toward adding to the pension contribution. So I'm not sure if I can't just recall exactly how they talked a little bit about the requirements of the employer. So maybe if you're to follow up with AMO, there may be your best. I know there's still a little bit of grayness but they tried to explain as best they could. And so if you follow up with AMO, they did, like I said, they did a webinar. I'm going to say maybe it was last Thursday. And so that helps, maybe through Kim could source that out. It did explain a lot of those questions and maybe a little bit more clarity from that. Obviously, it comes back from the province who is the administrative of that program, but it may help some if you want to follow up with that.
Thanks, Mr. Warden. I know through my day job, it was just on Friday, depending on the ministry, but the Ministry of Children and Youth Services provided documentation, and the money is starting to flow through that ministry. And they clarified that there'll be no employer expenses. So I think probably it's conversations within each ministry, but the money is starting to flow. Okay, any other questions in regards to Joanna's report?
Mr. Chair, if Kevin Wepler could speak just for a moment.
Absolutely. Kevin, you have the floor.
Thanks, Chair. Yeah, I did sit in on that AMO webinar on Friday, and we're still being encouraged not to release that funding yet because there's still conversations. We've got 3 different ministries handling this money for different organizations. So like public health and paramedics are under one ministry, long-term care is on another, and housing is on another ministry. There's still discussion on eligibility of certain workers and stuff, and exactly what is being eligible. Is the $4, does it include benefits? So is it a salary plus the benefits equals $4? So at this time, and they said we would be getting further information at the beginning of this month, and we're to be getting policy from the ministries. So we were told just to sit tight until we had all the information and understood the eligibility and questioned the eligibility where we felt those needed to be challenged or questioned. So that's what we're doing. I did send a letter out, or a memo out on Friday to all the staff saying that this money's coming, but we're working through with the ministry on this, and just to ensure that we do this right. So And that was shared with the directors, Jennifer and Kevin McNabb, and the rest of the senior management team as well. So that's where we're at with that pandemic pay.
Okay, thank you, Kevin. The chair has a question for Jennifer in regards to the additional beds. Jennifer, the $52,000 per year per bed, that's a daily per diem of about $142. Do you have some sense of what, moving forward, if we're advocating to the province for additional funding for long-term care, what should that daily per diem rate be? Now, I don't mean to put you on the spot, and feel free to defer it to another time, but there is some, there's some sense that there's going to be increased funding for long-term care, and it would be good for the members of the committee to advocate to know what that amount should be. It's certainly far less than what the hospital's per diem rate is.
Right, thank you, Mr. Chair. I will take you up on the offer to defer that answer, and Joanna and I will look into that and bring that information back, because I agree that's really useful information for the committee.
Okay, thank you.
Mr.
Okay,
Chair,
all
it's Brian.
all in favor? Sorry?
Mr. Chair, it's Brian. Can I just add to that? If Jennifer's
Yes, Brian,
bringing
go ahead.
something back, you had just mentioned that the hospital is quite different than for funding. I'd like to know what the hospital is, the per diem per day as well, when she brings that report back, if that's okay.
Okay, is that all right, Jennifer? Some comparisons with the hospital?
Certainly.
Mr. Chair, we can do our best to get that information, but I'm not sure that it will be as straightforward as we might hope, given that depending on where you are, if you're on the medical floor or ICU or obstetrics, your daily rate might be quite a lot different. But we can see what information is available publicly by way of a comparison.
Thank you.
Okay, thanks, Kim. Yeah,
Mr.
and
Chair.
I know it may be difficult with the hospital, but hopefully we can get some idea of what we need in our long-term care to properly staff and properly look after our residents. Okay,
Mr.
so
Chair.
all in favor of that report?
Mr. Chair,
Yes?
sorry, I think Kevin Wepler would like to speak to that too.
Oh, sorry, Kevin, go ahead.
Yeah, I think per diem's one thing, but I really think what you're seeing in this report is all the PPE, the cleaning supplies, and the upstaffing that's going on to meet the directives of the ministry for, if the clients have to be served in their room and stuff, that's caused additional time where in comparison to how we operated these homes before COVID. So yeah, I think if, the per diem's one thing, that's true. On an ongoing go forward basis, there needs to be more money in the system. But right now, what you're seeing in that, almost 1.4 million is the amount of masks, visors, gowns, cleaning supplies, additional staff for screening, et cetera, et cetera. That's where we really need our help right now, is to fund those one-time costs that are coming at us for this COVID pandemic, okay?
Okay, thank you, Kevin. And certainly we hope the ministry will provide that funding. They're the ones giving the ministry directives, so hopefully their funding continues to be attached to that. Okay, any other questions in regards to this report? Okay, seeing nothing, we'll call the question. All in favor? That is carried. Thank you. Okay, we have LTCRCM 1920 COVID-19 update. Can I have a mover for that, please? Moved by John, seconded by Warden McQueen. Jennifer, are you giving us this report?
I am. Thank you, Mr.
All right, the floor is yours.
Okay, thank you. So this is a COVID-19 update. And June marks the third month of navigating the pandemic and emergency measures related to COVID-19. Our homes are prepared and remain vigilant. The emergency order is extended until the end of June. In May, the homes were part of the mandatory universal swabbing, where 717 residents and staff were tested. This was a point-in-time prevalence study. We received one false positive result at Grey Gables. Public health was required to classify it as a suspect COVID-19 outbreak. Our months of preparation were quickly put into place. All residents, families, and staff were notified. Home areas were closed and residents isolated to their rooms. Infection control measures were enhanced, all within a couple of hours of receiving the news. The team at Grey Gables worked extremely hard to make that happen, and it was either a Saturday or a Sunday also. So it was good that we had all of that information ready to go. Public health worked quickly to retest the positive case, and within 3 days notification was received that it was a negative result. It was in fact a false positive. Ontario Health provided a directive on June 4th that all long-term care staff should be tested at reasonable intervals and a minimum of twice in the month of June. This will require a slightly different process than that of the point prevalence testing. While the earlier testing was coordinated with the Grey Gables Public Health Unit, the Ontario Health Directive removes public health from this role. Each home is required to coordinate their own strategy for completing the testing. This poses some challenges, including swab supply, staff compliance, organizational time and efforts, and the tracking of results. A plan to support this initiative and test staff during their regular work hours is under development. However, if staff come in on their own time and are willing to be tested, compensation for 1 hour of pay is recommended. The process for positive test results remain unchanged. The health unit will be notified by the lab and an outbreak declared in the home. As the community begins to reopen, there have been many discussions about what this means in long-term care. The social and emotional well-being of our residents has always been our focus, and the Color It Connect program has allowed loved ones to stay connected. After consultation with public health and our clinical teams, our homes introduced window visits just in time for Mother's Day. These have been very well received, however, do not meet the needs of all of our residents. Planning for the introduction of outside visits has begun, with a goal to have this in place for Father's Day. At the regional level, a guiding principle document to support long-term care homes in planning for safe visiting is being created. Once this document is released, it will help guide our homes for visitor expansion to ensure we're meeting the needs of our residents in these very challenging times. Each home is also developing a plan for a measured approach to a new normal in long-term care. All of the restrictions that were put into place at the beginning of the pandemic to prevent and manage an outbreak of COVID-19 remain in place. The next steps are determining what measures must remain in place and what can be scaled back or adjusted. Our guiding principles for this work are the overall well-being of the residents, staffing resources, PPE supplies, infection prevention and control strategies, and fiscal responsibility. This plan must also include measures to continuously evaluate and ramp back up strategies if necessary. Regular virtual meetings for families and staff are being held. Over the past few months, our homes have also created wonderful videos that have been shared in the monthly newsletters. Our staffing levels are adequate at the present time, and we have continued to recruit for nursing, program, and dietary staff. There are approximately 5 redeployed staff working at Grey Gables and Lee Manor, and all 3 homes have hired temporary emergency support workers who are assisting in all departments. Our homes have returned to a full point of care documentation process, and our program staff are now conducting small home area group activities, but still maintaining physical distancing. The financial impacts we've discussed briefly, or well, not briefly, we've discussed them this morning, and responding to COVID-19 and complying with the provincial directives has required significant investments in additional staff time, equipment for the homes, like bedside trays for in-room meals, and PPE for staff. Barring outbreaks in the home, there are adequate supplies to carry us through to December 2020. We are reviewing our staffing strategies to ensure we're staffing to the level appropriate for the current level of risk. COVID-19 expenditures are being tracked, and there will be a reconciliation between these and the special funding received from the province. As we discussed earlier, the details surrounding pandemic pay are being assessed as we receive them, and Corporate Services Director Kevin Wepler has sent a memo to update staff on the status. The ministry this week has advised there will be no rate increase for resident accommodation until January 1st, 2021. In conclusion, June is Seniors Month, recognizing the contributions of our seniors within our communities. The provincial theme is Aging Strong, respect and protect our seniors, and each of the 3 homes have different initiatives and strategies planned to recognize Seniors Month. Grey County staff are committed and dedicated to working collaboratively with the healthcare sector on new strategies, implementing outbreak protocols, managing and monitoring PPE supplies, and ensuring the ongoing communication with residents, families, staff, and the community. That is our update. If you have any questions, happy to answer those.
Okay, Jennifer, thank you very much for the report. And on behalf of the committee, a sincere appreciation to all of the senior staff, all the staff in long-term care for their continued efforts through this difficult time. You're doing top-notch job, and members of the public are so thankful for the way you're looking after our seniors. So thanks very much. Do we have some questions for Jennifer's update?
Mr. Chair, it's Brian. I have a question.
Brian, you have the floor.
Thank you. Just wondering about the redevelopment costs that came from Sienna, and they're $180,000 to $230,000 per bed, and that's the construction estimate. Does anyone find that those numbers troubling other than me? I'd hate to be Kevin Wepler dealing with estimates that vary by $50,000 per bed. Do we get something more concrete than this?
Mr. Chair, I'll take that. It's Kim.
Okay, Kim, you have the floor. Thank you.
I'm about to provide a redevelopment update, and so I can touch on some of that there, but I think the bottom line is that there is some potential for the both the design requirements and the construction funding aspects of a redevelopment project to be revisited by the province as a result of some of the learning from the whole COVID crisis. We're expecting to get more information from the province in the coming months. At this time, all we can really do is look around and see what other jurisdictions who have done redevelopments recently are seeing as far as their costs. But it's so challenging to compare. Every site has its own unique characteristics. The construction market is different in each place, and the level of finishes and that people might be looking for also varies from one place to another. So it's a real challenge to determine exactly what's what. But that 180,000 was a number that as staff we felt we could recommend without having additional information otherwise.
Fair enough. Thanks, Kim.
Thank you, Kim. Any other questions for Jennifer's report? Jennifer, you touched on there's a committee set up to look at the reintroduction of family visits. Can you just give the committee some sense of what the precautions may be when family visits are opened up again?
Certainly, thank you. So the regional group is actively working on guiding principles to support homes in making their plans, while at the same time we are anticipating an update in Directive Number 3 from the province that will give us more of that information. So the guiding principle document is looking at things like how would we set up visits in a measured fashion. So residents may have 1 or 2 designated visitors. What kind of education would we provide those visitors? around wearing PPE and where the designated visiting space is, what kind of supplies we need to have on hand, that kind of information. And we're working in partnership with public health to look at some of those areas. And as I said, we are anticipating an update this week from the province with some more guidelines around visiting in specifically in long-term care.
Okay, thank you. Okay, seeing no other questions, all in favor of the update report? That is carried. Thank you. Redevelopment update. Kim, I believe you are taking this one.
I am. Thanks, Mr. Chair. I'm going to try and share my screen without activating my video. This is an experiment and we'll see if it works. Okay, except for I need Rob to enable participant screen sharing.
I'm on it. I'm on it.
Sorry,
You're good.
Rob, I apologize.
Okay, you can give
Nice to be valued, eh, Rob?
Yeah.
There we are. Okay. Can everyone see that okay?
Yes.
Okay. All right. So this is the long-term care redevelopment update as of June 2020. There are two parts to it. The first is with regard to discussions that we've had recently with the Ministry of Long-Term Care. And we have a new project manager, and her name's Julie Gerard. And we worked with her earlier, so it's great to have someone that knows a little bit about what Grey County is all about. So I've had a couple of discussions since our last meeting with the province, both on the 19th of May and again on the 3rd of June. As you know, we received confirmation from the province a year ago that we could move forward with the redevelopment of the Rockwood Terrace facility. What they've since provided to us is both a development application template and the long-term care home preliminary plan submission standards for staff's review. They provided me their background documents. I in turn gave them the bylaw that the county passed approving the property exchange. And you'll recall from an earlier discussion that that was important to the province, that we confirmed that we had property to move forward with. So the next step in the approval process for the new facility is the licensing review. The province needs to confirm that they will grant the license to operate the beds in the new location. You can appreciate that in earlier models and earlier discussions prior to what we're working on now, this posed some challenges potentially. We're not anticipating any roadblocks in this regard, given that we're intend to build the new facility essentially in the exact same spot as the existing one. The province does have some direct discretion with regard to the format of any public consultation. It may be that the director simply approves the license, or they may decide that they want to either have some sort of an online consultation, or even going so far as an in-person consultation, although with the current COVID situation, I find the latter to be unlikely. They'll think about what they want to do, and then we'll be advised. The second part of this is funding approval. So this is really where the construction funds become allocated to Grey County. This is an internal process to the Ministry of Long-Term Care. Taken together, the best advice is that we can expect it will be several months before we both get the license and the funding approval. I asked if there was anything else that we needed to provide, but the application and the information that we've given them up till now is deemed to be sufficient. they don't need anything more from us. It's just a matter of getting this, the package put together and in front of Minister Fullerton. Upon receipt of funding approval, then our ministry project manager will be in contact to obtain the information needed to create the development agreement. This is where it gets interesting in case there were changes to the design standards for the homes. Part of that development agreement asks for timelines, asks for a site plan, asks for drawings, preliminary drawings of the you intend to construct. So there will be some work for us in that regard, and really we're kind of a little bit of a wait and see situation. We hope that given the great work that Advantage Ontario has done in keeping us advised of how things are developing at the province, that between our own provincial contacts and Advantage, we'll have a good sense of which way things are moving if they are going to impose new or different requirements to a new facility. So I'll stop there just for a second. Does anybody have any questions just with regard to the Ministry of Long-Term Care?
So I can't see anybody right now. Is there any questions? Just speak up.
Okay.
Kim, one question. The new commission that Premier Ford has announced in regards to long-term care, when is it to be established, and what's the time frame on recommendations from that commission? Because they may be looking at design standards, do you think?
They may well, yes. And I don't have any more information than what's been released publicly as far as
Okay.
Either the members of that committee specifically or the mandate that they've been given by the Premier's office. So we'll stay tuned. I expect that more information will be coming, and we'll make sure that that gets to this committee.
But it's likely safe to say that the province won't be making too many decisions until they have the recommendation from that commission, right?
I would expect that you're correct. I think that seems reasonable, and I expect that that group, that committee, will be tasked with moving quickly.
Okay, thank you.
Mr. Chair, it's Warden McQueen.
Yes, go ahead, Warden.
Thank you, Mr. Chair, and maybe to you, Madam CAO, or maybe others. Leading up to this, before COVID-19, and the whole part of the redevelopment of Rockwood Terrace was this deadline of 2025, and we must, go to from a Class C to a Class A type bed type home. Has there been any, and maybe that's the other thing, 2025 or 2021, but that's always been this line in the sand moving forward. Obviously, as you mentioned, Mr. Chair, with, the commission, obviously, and some of the, I would say, I guess, myself and the CAO had a couple of conversations with the ministry staff about following up from recommendations that come out of the Wastewater report. So you may be absolutely right, Mr. Chair, that there may be a whole new re-look at moving forward. And I guess maybe to the Madam CEO, maybe there just needs to be that conversation with ministry staff. What's is a 2025 thing now, off the table, or even just that ask of the status of that 2025, because obviously, there's a lot of things have changed, and maybe realistically that is no longer the realistic part of that 2025.
We have had some conversations with regard to a deadline to the facility. We are working as closely with the ministry as we can. Our intent as staff is to keep this project moving forward. In my experience with working on other projects with the province, if they see that you are committed and moving forward in a systematic fashion, they're more inclined to work with you. rather than, have concerns that the project is being held up and is at some risk. I don't.
Well, that's just to follow up. That's good to know, and just keep our pedal to the metal and keep pushing on.
Exactly. Okay, so if I may, Mr. Chair, I'll move on to the second part of my report.
Yes, please move on, Kim. Thank you.
So the second part of this report, and I will share, these notes will be shared with the minutes, or that I wasn't able to get them to you earlier. We had a visioning session last Wednesday, and there were a number of county staff there, myself, the Director of Planning, the Director of Economic Development, Jennifer as Long-Term Care, and Karen from Rockwood Terrace, as well as members from West Grey, the CAO Laura, their planning manager, Lorelei Spencer, and Davidson, who also does planning for West Grey. And we really took a couple of hours to through this 30-acre parcel and what we knew and what we needed to think about moving forward as far as redevelopment. So the first part of this timeline is really just trying to summarize for everybody's benefit, where are we now? So we're well underway with our property acquisition, and we expect to close on the new property in July. GM Blue Plan, as part of our due diligence for that property acquisition, did a phase 1 and a scoped phase 2 environmental assessment on the property. We have done, had the conversation with Saugeen Valley with regard to species at risk, and didn't have any adverse findings there. We need to arrange the completion of a D6 study to examine the any compatibility issues between proposed uses of our property, our new property, and the adjacent Durham stone and paving, industrial and aggregate uses. So all of this in service to creating an overall vision for the things that we want to see on the property and where those things should logically be located. Grey County will also arrange the completion of an overall functional servicing and stormwater management plan. So we need to look, we know where the water and wastewater connections are now. So what's the logical way to extend those? How do we want to handle stormwater on the site, given the hydrogeology and the topography of the site? We have a fair idea of what the main roadways look like and what's logical to extend there. And we know that there will need to be some berming on the property, and where to put that and how to integrate that into as a, potentially a feature of the property in the future. When all of those things are done, West Grey Council needs to provide approval of the overall concept for the parcel and lift a hold that's on there right now, and that will enable the development to proceed. At the same time, West Grey is currently updating their official plan and zoning bylaw, and there will be discussions between the two planning groups to determine the best designation and zoning to accommodate the potential uses for the site. So we're grateful that we're able to work collaboratively on this. It would be unfortunate if there was a change in West Grey that then caused the county to turn around and have to make application to have that changed. So we'll try to avoid that sort of thing if we can. West Grey has submitted their community improvement plan to the province, and having that CIP in place will be beneficial for any future housing development that might go on the property as far as incentives go. We think that the best way to proceed is to have the entire property divided into blocks based on the concept plan. So there's a long-term care block, a housing block, likely a service commercial block. And once the desired concept is established and supported by West Grey, the housing aspect of things, probably the RFP process, similar to what County Council would recall we used with the Trimble project, might be useful here as well, to say we've got a vision and put that out there for the private sector to take a look at and provide some proposals about. So the existing water and wastewater servicing and road connections So there's some details here. I think the best thing that I can do is I'll just share with you a couple of concepts, and these are really just concepts that were created actually by a transportation engineer. So here is the first. Can you see that? Okay.
No.
A little bit faint. If you can you see can you see that?
We're not seeing anything, Kim.
Oh, you know what? I have to go back through. I apologize. 1 second here. Perhaps. This is I got it here.
There we go.
Now we have it.
Okay, thanks. Extra step there I needed to be. So here's one concept for the property. And just to orient yourselves, here's the school. Here's the existing Rockwood Terrace property. And then the curling club is in the lower left-hand side of your screen. Adjacent to the curling club is what is a location that could be used for the long-term care facility. So that's what you see there, and with the parking. And then you see the extension of Rock Street. And then this design just shows what looks like a more traditional type subdivision layout for housing. One of the interesting parts of this is open space in the center of that development. So that's one potential, and I will show you another one. I'm really not doing these justice. This particular version also shows the long-term care facility in a similar place. It shows some other uses on the site adjacent to the roadway there. This is where you could get other institutional or commercial uses. And this site actually, those things that look like wind turbines along the side are actually a 6-story residential. And then there's a lot of natural space and trails. This is stormwater management there on the right-hand side in the corner. So there's some potential there as well to look at something that gets the same number of housing units on the site, but maybe offers some potential for more rental housing, a little higher density in the housing part, but then that allows you to preserve a lot of the natural space on the site. I'll go back now.
I'm glad those aren't wind turbines, Kim.
Yes. Go back to here. Oh shoot, sorry, I apologize. This is the wrong thing. This is the one you want. Okay, so as I said, we've looked at stormwater management only at a very high level, but there's more investigation to be done. So they just prepared a couple of concepts, and I think the takeaway from there is that the feeling now is that the logical place for the long-term care is closer to the curling club than closer to being in behind the existing Rockwood Terrace, just because of the grades and the natural drainage on the property. The other things that we talked about when considering how best to develop the site. Rental housing is an acute need in all of Grey County, but and it's not different in Durham. So if we can use this as an opportunity to address some of that, it might be beneficial. Recent consultations in West Grey placed a high value on rural heritage and natural areas. So that idea of having an alternative to a traditional subdivision type development might, be something that the public was interested in. Open space, recreational areas, spots to gather, pickleball courts, trails, etc., with the amenities that people might be interested in seeing on the property. It's important, we think, that the Rockwood Terrace facility, both the existing one and the new one, are integrated into the overall concept of the development. Like, there's things to see, and it feels like it's part of a whole rather than a separate thing over off in the corner by itself. There may be some potential to investigate a land swap with the school board to get more parking for the existing Rockwood Terrace facility if we were to repurpose that. At the same time, then providing them with some of the treed and berm area that's along their south border, but that would need to be discussed with them. There's the potential for a new ambulance station in Durham, and if that could also be put into the site considerations. Other opportunities to meet or to link the school and school programming with a daycare center and the long-term care facility seem to be something that we see working well in other jurisdictions. And then just when thinking about the housing that would go onto the site in the future, are there unmet needs for long-term care staff, hospital staff, or other large employers, in considering the kind of price point that would be attractive to that workforce? Do we want to make sure that the houses that get built are ones that those folks would be able to see themselves moving into? The campus of care model that we've talked about a lot is also part of considering what that housing looked like. And this is where we got into a really good discussion about companion community programs like Day Away and respite care, understanding what those needs are and whether or not some of our existing providers like HCSS might be interested in providing input into the development of something here. A clear link from this site to the downtown, and also understanding what existing funds might be available to activate parts of the overall concept. Like, are there parkland dedication funds or DCs that might be available to help with the creation of sidewalks or trails? Service commercial is another thing for the people that live there. Are there hairstylists or dentist's office, massage therapy, convenience, commercial or cafes, that sort of thing that could be included maybe on the main floor of a taller development. There's some potential for underground or covered parking, and also thinking about consultation. Who are the key stakeholders in all of this, and when to have conversations with folks and engage the community with their thoughts and suggestions once we had a concept plan that was somewhat more developed. So that was that conversation. I think we covered a lot of ground in a couple of hours, and I'm interested to hear if the committee has any comments.
Okay, thank you, Kim. Yes, go ahead, Christine.
Thank you, Mr. Chair. I really appreciate it. Kim, a very exciting report, lots of detail. This is really good, a really good report, and certainly needed. Kim, I'm wondering, in terms of the time frame for West Grey Council to address some of the planning matters, for example, removing the holding symbol. Any idea, is that going to be within the next couple months? Certainly West Grey's looking at a new official plan, and it's my understanding we'll have the draft towards the end of this month. Just your thoughts on all of that, please.
The D6 study needs to be completed for sure. Director Schertzer was going to reach out to get that going, and I haven't heard about a completion date for that. So that may be that we'll continue to develop these concepts and put more information in, but we do need that D6 to be done. And I will find out what he heard back as far as the consultant's ability to get that completed.
Excellent. And Mr. Chair, one supplementary question, if I might.
Go ahead, Christine.
Thank you. Kim, I was wondering if there was merit in, certainly after County Council is apprised of this information, of whether there's merit in a media release, just letting our Grey County citizens know where we're at right now with the redevelopment of Rockwood Terrace.
I was thinking that, through you, Mr. Chair, once we had completely closed on the property, that at that point, that would be at the right time to be able to say, you know, we own this, and now we're going to undertake a project then to move forward with the redevelopment of it.
Great. Thank you very much. Well done, Kim.
Thank you.
Yeah, thanks, Kim. Kim, you mentioned the D6 Compatibility Study. I'm not familiar with the D6 study. Can you just highlight, you know, who would do that and how much time one of those takes?
So these are studies. There's a D4 study if you want to locate something near a landfill site, and a D6 study is also is a different kind of compatibility where you're looking at an industrial use that's adjacent to a residential use, and they look at things like the potential for you know, the need for noise attenuation. Is that what's happening on that industrial site? Is it noisy? Is it dusty? Which way does the wind blow? That sort of thing. And so then that informs what you should and could do on the residential side to make sure that you're not setting yourself up for problems down the road, right? How things are situated in that residential development. Where do you put things? What kind of buildings could or should you put on the site that won't be, and the residents won't be adversely impacted by the residential use? It'll inform things like other setbacks, and that's where we get into some of that berming discussion, I think.
Okay, thank you, Kim. Any other questions from
Mr. Chair? It's Barb. If I may.
Barb, go ahead. You have the floor.
Thank you. This is very exciting, Kim. It was the first slide you showed us of the general concept. I thought, but the second one, oh my goodness, that is so exciting to see some innovative thinking going on in there, ticking all of the boxes that we need in terms of rental accommodation, diversified accommodation, potential for rentals and smaller homes for folks that people can afford it, managing homes for the workforce and so on. I think that is very, very exciting. You've obviously, the whole group of you have done an amazing amount of thinking on this, and it's very exciting to see. So next steps in terms of the concept and, you know, how this, the long-term care is going to integrate into that whole thing, because one of the things that we've heard often with in discussing long-term care and how our seniors should be housed in areas of increased activity that keeps spirits alive and that kind of sense of place belonging in a community as opposed to being isolated in a particular corner. So I'm wondering about next steps in terms of design and how that proceeds and from an input perspective.
Thanks very much. I was not wanting to get out too far ahead of all of you and wanting to make sure that you were all comfortable with the conversations that we've had to date. If I can take away from this meeting and from County Council's review of these minutes, people are comfortable, then I think likely the next step is to formalize this into a proper project with a project plan and with some staff resources that are more dedicated to moving this along. So Randy on the planning side, Randy Schutzer is taking care of moving those conversations forward. So that work isn't stopping. But now it's more about that whole consultation and continuing to pull all the pieces together. So I will have a report for you the next time we meet to talk about what that project plan looks like and how we're going to resource this properly.
Great.
Thank you. Well done.
Yeah.
Mr. Chair,
Other questions?
Mr. Chair, Warden McQueen here.
Go ahead, Warden.
Yes, and I just echo the comments that have been said. Yeah, great forward thinking. A few months back, we had planned to do a visit of the Simcoe County system, and because of COVID-19, definitely canceled. I wonder, and part of our design, and it was mentioned, Kim mentioned there a few minutes ago about the campus of care that we wanted to investigate. Is it possible that we can do a virtual meeting with Simcoe County just to have that conversation and maybe plan maybe something to the fall when things start to get back to a little bit more of a normality in the sense of us having a visit? Is that something that maybe we could at least have that conversation to start that carry on that conversation and that concept forward, Mr. Chair, in the sense of at least having a virtual meeting with those from Simcoe County?
All right, Kim, do you want to take that question?
I think one thing I know is that Simcoe County does have a virtual tour of their facility online. And I'm looking to Jen, maybe it would be useful for us to have, if Jane was available or one of the staff, we could take a look at the virtual tour that they've already done and then have some conversation with somebody from long-term care in Simcoe. Does that seem like something we could set up, Jen?
Yes, I think so. Part of the tour was going to be a presentation. So we can reach out to Simcoe and coordinate the presentation through Zoom.
Thanks, Jennifer. Yeah, if we could, at our next meeting in July, if we could maybe coordinate that presentation and the virtual tour, that would be great. It would certainly help the committee members as, we're looking at the development of the Rockwood area. Okay, any other questions for Kim? Okay, well, thanks very much, Kim. And it really is, as Barb had mentioned, it's really nice to see that we're thinking outside the box. And that second development, it looked nice with all the green space. And I like what like the direction that we're going. And I hope West Gray doesn't provide any roadblocks for us.
No, we're very supportive of the project. Very excited for our Gray County citizens.
Thank you.
Okay, is there any new business?
Mr. Chair, if I may, I just have an update.
Yes, Jennifer, go ahead.
Thank you. So we received a memo from Ontario Health West, formerly known as the Southwest LHIN, regarding our LSAW agreement, our Service Accountability Agreement. And you'll recall that's an agreement that we review annually, and the warden and the clerk put their signatures on it. And so they have recently extended the agreement to June 30th, and the memo that will be circulated with the minutes indicates that we can expect some more documentation to extend the existing service agreement to March 31st, 2021. And it doesn't give a lot of information in the memo, just that that is their plan, their anticipated plans. And so when there is more information, I will bring that to committee.
Okay, thank you for that update, Jennifer. Any other business? All right, seeing nothing.
Yeah, just one thing, Mr. Chair.
But go ahead, Warden.
Just with the announcement of the $150 million for the expansion of broadband in Ontario, we're going to have to try to really try to work on Georgian Bluffs so our chair can get on for broadband and internet. We'll have to really work on that.
You're right, because the vice chair is not paid enough. Okay, can I have a mover to adjourn, please? Moved by John and seconded by Barb. Thanks very much, everyone. Nice seeing you, and see
Take
most
care.
of you again on Thursday. Take
Well
care.
done.
See you Thursday. Bye.